Hello and welcome. This is Dr. GERARD CUOMO in Boca Raton. We're going over June's case today, and June presented with actually three missing teeth, and we went ahead and placed two implants. These are the Straumann bone level implants, of course, as we've covered in other video series. My laboratory, which is Linda Petro Lab, has presented these. They're doing everything by hand. And so they're waxing up the abutment teeth. Now these are screw retained. This is just a rough-in. Now we could accept these wax ups, but the lab would have to morph this first bicuspid a little bit more into the mesial, and what they're going to end up doing is finding themselves a little thin here on the distal, and they're asking me to okay that. Now the second molar or bicuspid back here is in a little better shape. It has a nicer contour because there's lots of room around that. So I guess the question is do we morph this one in a little bit, make it wider than this one, or should we make the back ends maybe starting from here and working our way into the inner prox area and coming all the way up on this side and doing that all in metal, highly polished metal, so it adds to a real sound distal. So if a patient bites down on that, they won't fracture the porcelain through the inner prox. These are implants. I think eventually they may be opposing another implant, so that was my concern, because it wasn't, a little bit more mesial would have been great, and the implants are spaced very far apart from each other. I would have liked to see them a little closer. We can also make this one a molar. You don't have to design it as a bicuspid. You can actually make this a little bit wider to give her a little more performance on the lower. But let's just check and see where the contact's being made on the lower. And yes, we could come more distal on that. So I would say this. I would make the distal from the distal facial corner of the tooth, of the point angle, wrap the metal well into the inner prox on number this is number 4, and just have it come up onto the occlusal and wrap around the orifice of this opening here, and have it come down so it supports this area real well in design. And make number 3 actually a molar. Okay, it's designed as a bicuspid, but I think we can add to that, make that a molar. All right, to show you the design, simply put, this is number 4. We kind of wrapped it, have it come in from the lingual in through the inner prox. So all of this would be in metal back in here, including the orifice. So we know it's a little skewed to the distal. 3 can be a normal anatomical design for a molar. And that's about it for now. That's our design. For you that are using software generated scanning and software techniques, you would be doing all this on a PC, and eventually a milling, or even today now they have the new printers that are out there that will print the patterns for you, and then you can either have them casted, or they're even making them all zirconia now through the Straumann digital scanners as well as software. So anyway, this is a little discussion about our case, and I'm going to meet with my lab now, Linda Petro, here in Boca Raton, and we'll walk through this together, and we'll come up with what's best for our patients. Dr. GERARD CUOMO, enjoying another implant case, and feel free to call or contact us at any time here at the office. I'll be happy to talk to you, and any of your trouble cases, we'll be happy to discuss them with you. Take care, and we'll see you next time.